Hey girlfriend, this is Jan James. Welcome to the Hope After Breast Cancer podcast, where women who have endured breast cancer learn to have fulfillment over frustration, clarity over confusion, and faith over fear. We tackle the issues that many of our sisters face after a breast cancer diagnosis, from brain fog to fear of recurrence, from menopause to sex after breast cancer. This is the place to learn how to have hope after breast cancer. So strap yourself in. Welcome to the Hope After Breast Cancer podcast. Hi everyone, it's Jan James with Hope After Breast Cancer, and we're here with my friend, my gynae and women's health educator, Kristina Calligan. We're going to talk about some hormone stuff. So tell us about testosterone and DHEA.
Yeah.
You're the expert.
One of the most common questions that I get from patients, or even just in general from other practitioners, is it safe for women with a history of breast cancer to be on testosterone and or DHEA? And they come in several forms: vaginal creams, pellets, lozenges, injections. So I first, before we even kind of go down that exact answer, I'd like to first just back up a little bit and talk about the chemistry of these hormones. So DHEA sulfate specifically, is the precursor to testosterone. Testosterone then is more, this DHEA to testosterone conversion can occur in the systemic level or at the peripheral level. And this is important because when we talk about different treatment options, sometimes systemically it's not recommended. And systemically means it's something that would affect or change your serum blood level or kind of get throughout your entire body. Peripherally would be more at a targeted zone. So all throughout our body, with all sorts of different types of hormones, there's receptor sites for that. And so when we talk about this, if it's peripheral or more, if it's peripheral targeted or if it's more systemic therapy, that would or wouldn't be safe when you have a history of breast cancer. DHEA also, with testosterone, then can convert to estradiol. Estradiol is the estrogen that is found or secreted from the ovary. So through this process of taking systemically DHEAS, you can convert to testosterone. If you were taking this orally, getting throughout your system and checking blood levels, you would see a rise in your DHEAS, you would see a rise in your testosterone, and if you were deficient, then you may see this conversion that happens and an elevation in your estrogen. Now, in order for the testosterone to convert to estrogen, then it needs what's called an aromatase. And so it's a type of catalyst enzyme that creates this conversion that happens. Now, as many of you women have known, a lot of women are on what's called aromatase inhibitors. And so they stop this transition to where the peripheral site, then the only thing it can convert to, if you were on a DHEAS or a testosterone, but you took that with an aromatase inhibitor, then you should not see a blood level rise of the estrogen.
Okay, so let me just geek.
Yeah.
You are geeky
today. I'm trying this.
No, that's okay. Okay, so let me just say, so the aromatase inhibitors are the hormone blockers that a bunch of us have taken. Is tamoxifen one? Mm-hmm. Is Arimidex?
So the more common ones is anastrozole and letrozole. They normally always end with ZOLE.
Okay.
There's quite a few other ones that I may not even be as familiar with, but yes.
Okay, so for those of us that were ER positive, we definitely are trying to block additional estrogen production in our bodies because it could refuel a recurrence, right?
Correct. Okay. Or if you've had risk-reducing surgery by removing your ovaries, then this can still happen. This conversion can still happen by even with extra adipose tissues and other areas where we carry estrogens.
Okay. Now I'm going to go way back. Explain what DHEA is.
So it is a hormone that is secreted mostly from our adrenal glands that then turns to testosterone and estrogen. It's an important part of our body that can really help with cellular revision, division. Through this whole talk, I want to make sure that's important to know that DHEA or DHEAS is not the enemy. And if we're using this at a peripheral targeted area, such as in the vaginal tissue, and for those of you that may be a little bit more familiar, DHEAS is intrarosa, or you could get your this compounded, so under a different type of formulation or with other things. So if we're delivering DHEA to the vaginal tissue, where it doesn't have the potential to convert, then that is quite a bit, if not all, safer than if you were taking a DHEA supplement.
Okay, that was one of my questions too. When you're talking peripherally, it means that you're just like, you're using that hormone on a specific area.
Targeted area where it's not going to convert to anything else or change.
As opposed to supplementally, you're taking a pill or whatever, that kind of thing, right?
Absolutely.
And then it has a systemic effect on your
Correct.
body.
And so one of the questions I get asked a lot is, can I take testosterone pellets? And there is actually even a commercially available testosterone pellet called BioT that has an aromatase inhibitor in it, to where the testosterone is not converting over to the estrogen. What I can tell you is that is what kind of is the science behind it, but the clinical studies and the number of women that have taken it without having recurrence of breast cancer is very, very limited.
Okay, so you would not recommend it at this point?
I would,
until there's more studies.
So with my patients and education, I try to get down to what the symptom actually is and not be so focused on getting a testosterone level. I don't treat lab levels unless they're elevated to lower them. So it's what is the actual complaint or diagnosis that we're treating. Is it true that maybe in some patients who have failed every other treatment option that knowingly accepted this and continued on with pellets? Yes, I do have patients like that.
Okay, gotcha. Very good.
I would say it wouldn't be first, second, or third line for me. But if there was some life impacting and we're talking quality of life and the woman is very well educated and she chooses to do that, then that's something that is available.
Okay, cool. Awesome. Thanks. I'm going to have to watch this video a couple of times because that was pretty meaty stuff. So that's good. We hope you guys got some value out of this. Thank you so much for coming to Hope After Breast Cancer. Take care.
You, Jan.
Thanks. Girlfriend, thank you so much for listening to our podcast. I hope you found some nuggets to encourage you and give you hope. Make sure you subscribe to the podcast. You never want to miss an episode. And we'd love to know how we're doing, so please be sure to leave us a review. Until next time, this is Jan James encouraging you to remember there is hope after breast cancer. See you next time.